Hello and welcome to the GRADD Dialogue. My guest today is Philip Patterson. Mr. Patterson is the new CEO of Owensboro Health and works with the board of directors of the Owensboro Health Systems and along with the executive team. Welcome to the GRADD Dialogue, Philip.
Thank you.
And let me kind of give you a brief overview since you kind of newcomer yet to Owensboro region. He has been with the Bond Scores Charity.
Mm-hmm.
Is that right, Bond
Score Charity Health System.
Bond Scores Charity Health Systems as a CEO, and also been a CEO at the Bond Scores Charity Health Systems, all together around 3 hospitals with a net revenue of about $500 million. Right. Again, welcome to Owensboro Health and also the GRADD region. But the new hospital just opened not too long ago, I think last June. Then you came on. So the 2 questions that you hear off and on in the outside the circle that you and I get together is who's gonna pay for that, and is the hospital really going down because of the floodplains and everything else? Sure. So let's kind of take that the myth out of the question before you talk about what are your plans?
Well, I think first of all, the hospital's doing fine financially.
Right.
So it's on solid footing financially, and I will also say that the new campus is on solid footing also. They had a team of experts looking at the new site for a number of years, and they've made sure that not only the ground would be able to sustain a building of that size, but also when you start with a good foundation, a good base in the way that they built it. And I think that they chose well, and the engineering team did a great job of building the hospital. I think it's interesting because now they've also used the same exact group to not only do the convention center base, but also the 2 hotels down there too. So they obviously are picking up a little steam on making sure that all the buildings
and all the
secure.
structures are sound and secure, which is great. I would have to say that when the hospital was under construction, we had a chance, been invited, bringing the regional leaders to, kind of periodically go through that, look at the hospitals, and it is, one of the great state-of-the-art facility. We are so proud to have, that for the whole region. So
wonderful.
So with that, again, welcome to Owensboro. Just talk about that. You have been. We talked earlier that you are from South in Mobile area. Spent a lot of years in New York, in the Hudson Valley.
Yeah.
Your wife is from Minneapolis area. So what attracted to Western Kentucky and to Owensboro?
Well, obviously the opportunity arose, and it's such a great opportunity to run such a prestigious organization. But what I think really brought us to Owensboro was the unique opportunity in such a wonderful place to raise a family. Being from Mobile, Alabama, the Hudson Valley was a fun place to live for a while, but it's not really somewhere you want to raise your kids when you talk about not being close to family, not being able to spend time with your loved ones. And so, it really posed itself as being a wonderful community for us. It's thriving in its own right, with all the growth that's going on downtown and all across the region itself. I think it's a great place to raise a family. But it's about halfway between the 2 families, so it worked out pretty well for both of us.
And it's a great combination, a brand new hospital, state-of-the-art hospital, and the youngest CEO running the hospital. Hey, you can't ask for any more,
Yeah, there you go.
Let's talk about, we see a lot of advertisements and taking pride on, calling the Owensboro Health one of the America's top 100 hospitals.
Yes.
How does it come about? I know it's a great honor. So what do you have to do? What do you accomplish, to get to that level?
Well, like I've said this morning in our meeting, is that you don't just in 1 year change the philosophy and therefore the quality and the outcomes in a facility quickly. So it has been a process that they've been working on. The senior team has been together for a long time, and I'm just I've got the great opportunity to join them and help to continue to grow Owensboro Health. But they've been on a path for a long time of being a quality provider, and they want to be seen not only regionally nationally, but nationally as one of the best. So it's been, they've been working on this for a number of years, and since 2009, they have progressively continued to be ranked as some of the best care outcomes in the country. And in the last two, they've made it to the top 100 hospitals. So a proud and momentous opportunity for us, but at the same time, we're not done. There's always an opportunity to be in the top 50 or the top 10 of the country, and I think that's the group that I've joined. They're always striving to be better.
And that has to be that you're lucky enough to have that type of management team and the employees, because you are one of the largest employer that we have in our region.
Absolutely.
So Owensboro Health, at times could be a misnomer because it's not just Owensboro. We're talking about a large region that you serve. Can you talk about that?
Well, our geographic footprint sometimes is not represented as well politically or within all the commercial sites because of the emphasis that's been placed on the Pleasant Valley location, the new hospital. It obviously has a very attractive appeal, and also went through a process of making sure that the community accepted it for what it was. But based on what Owensboro Health is, there really is a foundation of an entire organization that helped in making sure that when that hospital was built, it was supported.
I see.
So we've still got a number of opportunities and organizations within Owensboro Health that are represented on the old parish campus, as well as we have a number of locations throughout the entire 8-county region that GRADD represents. And we are proud of those operations and really are excited about their growth and their opportunity as they are bringing healthcare access to those local communities.
No, when you mentioned about the Parish Avenue campus, many of us, who have been in this town for, I guess in my case, almost 40 years or so. So we have great memories of that hospital.
Absolutely.
Our children's being born and our own taking the great, healthcare out of that facility as well. So give us an update, where we are on that, what are the plans for that, and, I see some construction or the demolition going on at the present time.
Well, it's really nice that that the organization has taken the opportunity to make sure that it doesn't become just an unused building representing some type of unnecessary opportunity within the organization in an area of the town that could potentially be detrimental when you have a facility that size. Being vacant. It tends to bring down the whole neighborhood. So the path that they have set before us, before I got there, was one of growth, of revitalization, not only for the campus, but the whole community. Access to the Macaulay Clinic and its years of service to the poor is going to be augmented and expanded. We're going to work in partnership with the residency program as we bring new doctors in to learn and to train under the excellent physicians that we have on staff, as well as continue to grow with our relationship with COSAR's children on that campus, with the University of Louisville and their nursing program on our campus, as well as continuing to expand the footprint that we have through the Mitchell Cancer Center. So a lot of things still going on that are very crucial to our organization on the parish campus.
So many of the facilities and programs are the viable programs. It's going to be at that, because there are all kinds of discussion about in the past. What we're going to be using that for some of the hospitals, some training from senior centers. But what you describe are the integral part of that will work with the Owensboro Health, with the new campus as well. So
Absolutely.
Yeah.
Well, I think it's really neat is that what the campus has turned into is not only a place of care, but a place of education and growth. We're talking about the next generation of nurses, the next generation of physicians. And it's best when you can bring them in an educational system, get them, acclimated to the region and make them want to stay here to then become providers of care for us. And we will know how they were trained because we did it ourselves in the care quality that we expect.
When we talk about the any kind of healthcare in this region, especially this being a kind of semi-rural urban region, so our biggest challenge has been to the access to the health care.
Absolutely.
Even though we have great hospitals or facilities like Owensboro Health, it's going to be the biggest issue. What are your plans? What are the hospital is taking steps in to make sure we have better access to the health care for the whole region?
Absolutely. You know, I think it started long before I got here. Back in 2006, we saw a need as an organization to expand the number of physicians so that each community we serve, not just here in Davis County, but the surrounding counties that we call our community globally, had the access to care at their front door, so that they were not always having to travel into the campus to get care, but actually sought care and access at a point that was appropriate. So people should be able to have access to their primary care physician close by and necessary. So we've now got a footprint that truly has clinic spaces in almost every county in our GRADD region, as well as the greater region that we serve outside of the GRADD region. And we're very proud that we've got providers and staff out there taking care of individuals outside of our main campus area.
I like your comments that you made to our board this afternoon that your goal is to not start building centers all around the region of your service area, but also to collaborate and work with the partners.
Absolutely. Well, we have a long history of doing that already. We have our Madisonville Clinic, which still primarily represents most of the care for our organization in that region, but they do most of their hospital care at the Baptist Hospital there in Madisonville, and only where appropriate, where we can still do things as a regional tertiary center, we bring those patients back here. Same with Madisonville. Ohio County, I know, is there, and we have providers who are right in and around some of those smaller providers, and we expect those physicians and those providers to utilize the health care that's in those communities.
And your staff, and especially the two that I work with very regularly, Mr. Steve Johnson and Debbie Zerner, they really believe in the regional health, with the need assessment that you guys are doing, that working with all the 7 counties to make sure that we have lowers the building system at the low level to and empowering the local areas, and then come back, and then look at what needs to be done.
Absolutely. I always say it's always kind of funny to hear a president of a health system say, our goal is to keep people out of the hospital, but that's true. We should be providing care that truly keeps people in their ability to maintain their health status once they leave our facilities, but then manage their care, manage their disease process so that they can have the most fulfilling life that they possibly can, not bouncing back and forth and into the hospital. So the more we can do to raise awareness and educate, as well as provide health care to those individuals to keep them out of the hospital, the better the health of our communities will be. So it truly is a goal that is, speaks to the mission statement of Owensboro Health.
Mr. Patterson, I think it's great that I'm proud to have you on our show and talk about these things, because regardless what people think about the affordable health care, there is always going to be need for quality care. And
Absolutely.
That's what you guys are providing.
Absolutely. No, thank you. It's we obviously, government's not the answer. It's about the care providers in those communities and how they are addressing the needs of their individual communities. And you mentioned the work that Debbie and Steve are doing with the community needs assessments, and I think that's a good pulse check for us. What are the needs of our communities, and looking at it every 3 years to make sure we're on the right course. But like I said, going back to that core mission, it's not just our goal to heal the sick. It is about making our communities healthier, and I think that is very important, and it is as important as treating those who seek care from us for some reason that they need, right now.
And that has an impact on everything from economic development to the education, everything else. So again,
Absolutely. Thank you very much.
And wish you best of luck. And,
thank you.
Hopefully we can revisit again in 5 years or so and see where we are. And
whenever you want me, I'll come back.
All right. Again, thank you for being on the GRADD Dialogue, and thank you for watching GRADD Dialogue. We've been talking to Mr. Philip Patterson. He is the new CEO of the Owensboro Health Systems. And if you have any questions about that, you can always call me at the GRADD office, 926-4433, or you can always call the hospital. He'd be glad to talk to you and answer your question. Thank you very much. Hello and welcome to the GRADD Dialogue. My guest this show is Levi Reams. Levi is from Kokomo, Indiana, but lives in Owensboro these days. He attended Indiana University in Kokomo in business management. While attending, he bought his first Comfort Keepers office in Kokomo. He later sold that business and looked to build another businesses that was somewhat close to home. Levi and his wife, Jamie, bought the Owensboro Comfort Keepers office in 2007, and they are currently have 100 employees. He has owned and operated several other businesses throughout the years, and he continues to have a success in the Comfort Keeper franchise. We are proud that you guys ended up buying the Comfort Keepers in this area as well, and kept that great business going in our region. He bought the Evansville Comfort Keeper location in 2011. He also serves on quite a few boards in Owensboro area. I guess the Rotary Club. I said Davis County because I'm the Davis County Club. We are the known club, Independence Bank Board, as well as the Elizabeth Munday Center Board. So, you are connected to GRADD in many different ways, but we're going to talk about today is your direct input and also the leadership in this, what we call the Stop Senior Hunger campaign. So again, welcome to the GRADD Dialogue. Let me just mention about the why we are doing this. 1 in 7 senior citizens is at a great risk of hunger, representing almost a 78% increase over the past decade. And according to 2012 numbers, Senior Hunger Report Card, again, it's one of the biggest tragedy that we had, that seniors go hunger because of the not being able to either afford the food or not having able to have an access to the food. So with that, Comfort Keeper and Independence Bank had joined with GRADD and has done Stop Senior Hunger campaign in the past. So this is a 2014. Welcome, and tell us about why Comfort Keeper is involved in the Stop Senior Hunger, and what are some of the dates for this year's event.
Okay, thanks for having me, Jiten.
Sure.
Comfort Keepers, primarily our clients are private pay. Sometimes people call us and they don't have the means to pay for services, and they just need somebody to come in and prepare a meal. So over the years, I keep hearing the same plea for somebody to come in, cook mom and dad a meal, and I keep hearing more of it. So we come up with this idea, and actually Comfort Keepers nationally has this campaign going, and I couldn't quite do it alone. I didn't know how to reach to the seniors, so we contacted GRADD, and they said, in fact, we have over 500 people on the Meals on Wheels waiting list, so that's how we pluck the people to get. And Independence Bank helps us as well. So this year we're kicking it off, a soft opening, March 24th. We're going to deliver boxes to all the participating businesses. And the 26th, we're going to have a press conference, and that will be our actual launch day.
When you say soft opening, is that providing the boxes, not the boxes of food, but the boxes for the food? Can you comment on those?
That's correct. Yeah, it's the collection box. They're large bins that'll be at IGA, Kroger, obviously GRADD, Comfort Keepers, and some other participating businesses in the community. They're pretty large bins that people, where the donated items where we collect for the month. That's where they go.
So the process is that people donate the items, or when they go shopping to Kroger, they buy extra cans and put in that bag or something. And what happens to all those things? What happens to those?
Well, there's quite a bit of logistics that goes in that. Once they get collected, the bins sometimes get full and almost run over because people are so generous. Canteen actually helps us get the food from all the collection locations. They take it to Owensboro Christian Church, and Owensboro Christian's been so generous to give us a large back room where we sort. And we sort there based on canned goods, fruits, vegetables, proteins. And then at the end of the month, we go out and put those in bags, and that's when the rubber meets the road. That's when they get delivered.
I see. So you had the Comfort Keeper, now the Canteen, now the Owensboro Christian Church, Independence Bank, GRADD. Wasn't other corporation in the past has given some meat or something for that?
SFG.
SFG.
Yes. Every year they give us enough ham. Usually 2 quarter hams for every one of the seniors. Usually they give us 1,000, 1,500 quarter hams, which is very nice of them. So that's how they help us in a big way with that.
Now, one thing I like what you guys are doing, and I think great initiative, no doubt about it. I agree there is a tremendous number of people waiting on the list, seniors especially for the food and everything else. But people have a tendency to help, the needy folks in our region, in our county communities during the holidays. But sometimes we forget that, they also need some help during the year. So, you guys having this, I guess sometime in April, May? Or when,
Actually, we kick off in March. We deliver the food May 7th.
So that means, this is more or less like maybe a Christmas in May in a sense.
In fact, it's enough food for these people, they say, for a little over a week and sometimes 2 weeks, depending on how much they spread their canned goods out, and maybe longer if they're light eaters. So it is Christmas in May, yes.
Now, Levi, talk about the official announcement that you guys are planning sometime in end of March or so, and what are the plans for that?
We have a actual kickoff press conference. Last year it was at Independence Bank in the lobby. We're going to do that this year on March 26th.
I see.
All the participating partners will come in, and that will be the actual opening of the food drive. So we're just waiting for that, and that'll get the word out, and hopefully people will start donating then.
But the boxes are going to these locations for start collecting the food right away.
A couple days before,
Okay,
a couple days before the press
That's a big
conference,
event,
yes.
Okay. So all overall, what are your estimate to see how many seniors you could be serving, and or how many pounds and cans and everything else? If you make an impact, a number of cans, a number of food that goes out.
That's a great question. I've always wanted to weigh it all. That's almost impossible. But we say we always like to reach as close to 500 people as possible.
Okay.
It's always been 350 and above. So if we want to round up and say 400 people get at least 20 canned goods, you can kind of do the math on that. Plus they all got a box of crackers, a can of peanut butter, and those 2 quarter hams from SFG. So that's quite a bit of food, really.
Yeah, it is. And how do you distribute those? You say you put in a bag, but who goes out, or how do you select who gets the food and everything else?
Yeah, that's where we need your help and the other volunteers' help. The participating companies from Comfort Keepers, GRADD, and Independence Bank, they all have volunteers and employees that come, and there's some other community volunteers. On the delivery day, we actually go get the bags, and that's when SFG backs their reefer truck up. So when the bags are already loaded, we have to put the ham in there, and then we get maps that Jennifer from GRADD helps us map out, and we get about, last year I had 12 stops, so I delivered 12 homes. So when you think 400 or 500 people, and I only got 12, there was that many volunteers delivering food.
Excellent.
So it's a true ground operation delivery.
Now, do you? I know last year was a lot of a lot of bags were given out to the needy seniors in Davis County, Hancock County. Are you guys expanding to include other counties as well?
We do. Like everything, remote counties are harder to service. It really helps if we have a volunteer within the county. I know Hancock County's got somebody that's really spearheading that, and they delivered around 70 bags last year. So if we have somebody from each county to kind of help us, it's a lot easier. We're not against going, all Western Kentucky if we have the help.
So, but the Independence Bank is in almost 5 of the 7 counties, maybe 6. I'm not sure of GRADD. So I guess at least they can empower, Independence Bank, to maybe provide. Maybe what we need to do is, maybe have a businesses adopt Stop Senior Hunger, so they can provide, the volunteers to, on that day to deliver the food. Because I remember at the time we used to start the repair affairs, where when corporate teams would adopt a home or two to repair those things, but for the seniors or low income. So this way, I think it'd be something we can think about that to maybe have other businesses at least provide a volunteer. They don't have to provide anything else. Now we're talking about that you would have those big boxes at all the locations, IGA, Kroger, and all and the areas, and people can buy the food and put the food. What people who do not have a time or don't want to get into all those buying food and everything else, can they just make a donation? And if they do, Is there any way that you could gauge, that okay, Jiten, if you put down 25 or something, that would fill up that, bag that you're going to deliver? So.
Yeah, some people obviously aren't. We get a lot of donations from seniors that are homebound themselves.
Okay.
So people can kick in monetarily. They can either send that to GRADD, Comfort Keepers. We prefer that to be mailed to the Independence Bank. They have a foundation actually set up that the money goes through this. All the proceeds that come in go right back out.
I see.
We actually enjoy some monetary donations because at the end of the food drive, we can backfill the items we're short on. I know last year we were real short on peanut butter, so that had to be backfilled with the cash. And I do want to mention the money that comes in from each county stays in the county.
I see.
So it stays in specific county boundaries.
That's important. And plus also every donation or any products, the food that people donate, everything is tax deductible.
That's correct. Yeah, it is a 501c3, the foundation, Independence Bank, and they, if it help us, they put Stop Senior Hunger on the memo line, so we know what they're donating to. But yeah, the neat thing, there's no administrative fees, 100% in, 100% out. So
some people are gonna say, oh, why they are doing this? We hear that GRADD and the state provides all the hot meals, and we got the senior centers for congregate meals and home developed meals. Even though GRADD has a contract with Canteen to cook almost 1,100 meals a day, we still have difficulty reaching out and providing meals to people who need it. And I think the Stop Senior Hunger does a tremendous job reaching that out. That it's not just one day meal, but this bag that you're talking about will last maybe a week or two. Okay.
Yeah. I couldn't imagine nationally. I know you said you delivered 1,100 meals here locally. Nationally, statistics, I just read them this morning, a little over 30% of all seniors either have to choose between medication or food. So I could not imagine having to choose between proper meds or feeding myself. So.
Especially in this country, that you have that type of dire need, and you guys are doing a tremendous job. I have to commend the not only your office, the Comfort Keeper, but the national office that taking this campaign. And I would imagine that they may be doing another part of the country as well. But I can guarantee you that we have the best Stop Senior Hunger project, and again through your leadership, and Daryl Higginbotham through the Independence Bank, really provide us a tremendous need. So I want to wish you best of luck. So anybody who is thinking about donating food for the Stop Senior Hunger, they can always contact Comfort Keeper and contact Levi or contact GRADD. But more importantly, look out for those boxes at the IGAs and Kroger's, and please donate, canned goods or a box of crackers or peanut butter. And if you cannot donate, please make a donation cash donation to any of those partners or Independence Bank, and we make sure that goes to the right seniors for the need. Levi, thank you again on the show, and wish you best of luck. We didn't say the date though. 26 is the kickoff date.
Yes.
So that's the date that everything begins. Okay.
That's correct. May 7th is the delivery day.
Is the delivery date.
Yeah,
all right. So okay, thank you very much, and please support the Stop Senior Hunger campaign for this area. Thank you.